Symptoms of constipation in a preschool child: irritability, abdominal pain, bleeding with passing stool, pain on defecation, lumpy and hard stool, perianal fissure, withholding behavior, having fewer than 2 movements a week, passing stools that are hard, dry, or lumpy, having stools that are difficult or painful to pass, telling you that they feel that not all stools has passed, a changing position to avoid or delay having a bowel movement, including standing on tiptoes and then rocking back on his or her heels, clenching his or her buttocks, doing unusual dance-like movements, having a swollen abdomen or bloating, having a daytime or nighttime wedding, having a low store in his or her underwear that looks like diarrhea. Constipation in preschool-aged children often present with symptoms that can affect the child's comfort and overall well-being. Recognizing these signs is crucial for timely and effective management. Bowel movements patterns and frequent bowel movements less than 3 times a week, difficulty passing stools. The child may express discomfort, pain, or strain during bowel movements. How dry stools often described as pallet-like, making them difficulty to pass. Abdominal symptom: abdominal pain, discomfort, or pain, especially before or during bowel movements. Including a sensation of fullness of swelling and that abdomen visible discomfort. The child might appear visibly uncomfortable, especially during attempts to pass stools. Behavioral signs: stool withholding behaviors, such as squatting, crossing legs, or refusing to sit on the toilet. Often due to care or painful defecation, avoidance of bowel movements. The child may avoid going to the bathroom due to previous painful experiences. Other associated symptoms: swollen or fecal incontinence, unintentional passage of small amounts of stool due to overflow and constipation, lack of appetite due to abdominal discomfort or feeling of fullness. Nausea: in some cases, severe constipation can lead to feeling of nausea. Contributing factors: dietary habits, low intake of fiber-rich foods such as fruits, vegetables, and whole grains. Fluid intake: insufficient consumption of fluids. Toilet training issues: stress or reluctance related to toilet training can contribute to constipation. Physical activity reduced. Physical activity can exacerbate constipation. Management strategies: dietary modification, increasing the intake of fiber-rich foods and ensuring adequate hydration. Encouraging regular toilet times, establishing a route can help promote regular bowel movements. Physical activity: encouraging regular physical activity to stimulate bowel movements. Positive reinforcement: using positive reinforcement to encourage sitting on the toilet and attempting bowel movements. When to seek medical advice: persistent symptoms if constipation persists despite home management, or if there are any concerns about the child's growth or well-being, severe pain or vomiting. These symptoms could indicate a more serious underlying condition. High points: constipation in preschool children is often characterized by infrequent, difficult, and painful bowel movements with hard, dry stools. Recognizing behavioral signs of stool withholding is important for early intervention. Management focuses on dietary and lifestyle changes, including increased fiber and fluid intake, regular toilet routines, and physical activity. Persistent or severe constipation warrants medical evaluation throughout underlying conditions and discuss additional treatment options such as laxatives under medical supervision. So, symptoms of constipation in a preschool child: irritability, abdominal pain, bleeding with passing stool, pain on defecation, lumpy and hard stool, perianal fissure, withholding behavior. Having fewer than 2 bowel movements a week, passing stools that are hard, dry, or lumpy, having stools that are difficult or painful to pass, telling you that they feel that not all stool has passed, changing positions to avoid or delay having a bowel movement, including standing on tiptoes and then rocking back on his or her heels, clenching his or her buttocks, doing unusual dance-like movements. Having a swollen abdomen or bloating, having daytime or nighttime wedding, having stool in his or her underwear that looks like diarrhea. Infrequent bowel movement, difficulty passing stools, hard, dry stools, abdominal pain, bloody, visible discomfort, stool retorting behaviors, avoidance of bowel movement, swelling or fecal incontinence, illegal appetite, nausea, dietary habits, fluid intake, toilet training issues, physical activity, dietary modification, encouraging regular toilet times, physical activity, positive reinforcement, persistent symptoms, severe pain or vomiting. Recognizing behavioral signs of stool withholding important for early intervention. Management focuses on dietary and lifestyle changes, medical evaluation throughout underlying conditions, discuss additional treatment options, laxative under medical supervision.